Hey everyone, today we are going to look at a skin condition called malignant melanoma. This condition arises due to the uncontrolled proliferation of melanocytes. This is what our normal skin cells look like. The grey dendritic cell you see here is a melanocyte, which is a melanin producing cell located in the bottom layer of the skin's epidermis. Melanin is the protective pigment primarily responsible for skin color. Let us take a closer look. When these cells proliferate uncontrollably, it results in a neoplasm of epidermal melanocytes called malignant melanoma. They produce large quantities of melanin or dark pigments, which results in localized darkening of the skin, forming a patch. These patches or melanomas can grow radially, which means a lateral increase in size confined to the epidermis, or they can grow vertically, which means invasion of underlying dermis and outward projection, as seen in this illustration. Let us look at some factors predisposing individuals to this condition. Remember, the phrase is fun in the sun, where the most important factor is sun exposure, especially on a beach vacation. The next important factor is UV rays. More harmful than the sun are those from artificial tanning booths, which have gained popularity world over. Fair, freckled individuals with red hair have a higher likelihood of suffering from this condition. People who have numerous nevi or many moles are also at greater risk. This disease is found more commonly in those of higher socioeconomic status, as only they can afford multiple beach vacations and tanning salons. Queensland in Australia is the worst affected worldwide. Malignant melanoma also shows a male predilection. Let us look at its clinical presentation. Usually, it is found on the skin. Mucosal melanomas are extremely rare. It can be a macular, meaning consisting of distinct spots, or nodular, meaning lump-like. It shows a color variation ranging from brown to black to blue. It commonly shows zones of depigmentation and has an irregular outline. Keeping this very image in mind, let us see the ABCDE of clinical diagnosis of malignant melanomas. A for asymmetric, B for border irregularities, C for color irregularities, D for diameter of more than 6 mm, and E for elevation. A particular form of this disease called Hutchinson freckle, also known as Hutchinson lentigo or lentigo maligna, affects females more than males. It is characterized by dark pigmentation on the skin of the face and neck in older individuals. The melanocytes are confined to the epidermis, and this is a pre-malignant condition. The important points you need to remember regarding histology of malignant melanoma is that the cells show large nuclei with prominent nucleoli and may be spindle-shaped or necrotized. It is characterized by large epithelioid melanocytes arranged in a pagetoid manner, which means upward spreading. It is also known by buckshot scatter pattern, which can be a major hint in multiple choice questions. Lesions on certain areas such as back, arm, neck, and scalp, which you can remember as bands, show a significantly higher risk of metastasis. The best treatment of malignant melanoma is surgical excision of the lesion. Depending on the spread, lymph node dissection may be required. Chemotherapy and other treatment modalities can be used as an adjunct. Here are few clinical images to help you diagnose this better and remember the standout points. First is a mucosal melanoma, which is extremely rare. Second is a skin lesion, clearly showing the localized elevated pigmentation. Use the third image to revise the ABCDE of clinical diagnosis. I'm sure you won't forget this easily. I hope this video helps you study this topic in no time. Let me know in the comments below. Don't forget to like this video and subscribe to our channel.